Welcome to today's Global Connections program. I'm Bill Miller. How widespread is the AIDS pandemic around the world? What are various institutions such as the United Nations and Columbia University doing to combat this horrific virus? We'll be back in just a moment to talk about these and other important issues. Welcome back to our program. Today we're going to look at a disease, a horrific disease called AIDS, and see how much progress we're making in the United States and around the world. My guest is an expert in this area. My guest today is Dr. Stephen Nicholas. Dr. Nicholas is a pediatrician and a pioneer in the care of HIV-infected children and their families. He started the Harlem Hospital Pediatric AIDS program in New York City in 1985. He co-founded the Incarnation Children's Center, New York's first residence for homeless children with AIDS, in 1988, and he founded the Columbia University International Family AIDS Program in 1999. Dr. Nicholas has been involved in a variety of international AIDS programs in Haiti, Russia, the Dominican Republic, South Africa, and many other countries. Dr. Stephen Nicholas, welcome to today's Global Connections program.
Thank you, Bill. It's great to be here with you.
I appreciate, Dr. Nicholas, Steve, as you said to call you, I appreciate you being with me today. Let's jump right into this. You started your career, you began early and started a very important program in Harlem in New York City area. And Harlem, as I understand it, has one of the highest rates of women and children infected with HIV/AIDS. What exactly was this program, and what were some of the accomplishments of the program?
In the early 1980s, as the AIDS epidemic was first being described in gay men, shortly thereafter we realized that also intravenous drug users were another population of individuals who had HIV. And it wasn't until about late 1982-83 that we discovered that pregnant women can pass the AIDS virus to their babies, sometimes during birth, sometimes by breastfeeding. And lo and behold, it turned out that Harlem had the highest rate of mother-baby AIDS in the United States. And because of that need, because AIDS quickly became the number one killer of children in Harlem during those years, I was part of a program to treat all these individuals that were infected. And then a couple of important things happened very quickly during this period. One, treatments came along first for adults and then for children. And so even though I was taking care of a fairly large number of children who in the early days were dying, all of them died, that seemed hopeless, as AIDS treatments were developed over the next 10 to 15 years, the children I was taking care of got older and older, and ultimately were not sick anymore. They're completely well, and many of those kids have now lived all the way into adulthood. Okay, so that's the first important thing that happened. But the even more important thing that happened, and this is I think one of the best stories of the whole AIDS era, is that it was discovered that if you give AIDS drugs to a pregnant woman who herself has got the virus, you can prevent the baby from being born with HIV, the AIDS virus. So that means that baby can be born AIDS-free with a proper kind of treatment. So what does that mean for a place like Harlem that a few years ago had so many dying children, so many children born with the virus? It means that the AIDS epidemic is virtually eliminated at this point in time.
That is remarkable.
Like a modern-day miracle.
It certainly is. That is absolutely remarkable. Now, you were focused primarily in the United States. You're originally from Wyoming. You've lived in the New York City area. You've worked at Columbia University. But you've also gone international, and you had not planned to go international, I guess, but you've been involved in a variety of anti-AIDS programs in Russia, I think St. Petersburg, in Haiti. You also had one, or have one, in the Dominican Republic. What is that program? Where is it located? And what are some of the situations as far as the Dominican Republic goes? We'll just use that as sort of a microcosm.
Dominican Republic is a country that I became involved with partly because our medical center, Columbia University Medical Center, sits in the northern part of Manhattan, and that neighborhood is predominantly Dominican, so people from the Dominican Republic. Dominican Republic sits on 2/3 of the same island that Haiti is located. And we've known from the beginning of the AIDS epidemic that Haiti had a problem with AIDS, still does, but we didn't know much about the problem in the Dominican Republic. But it turns out this is also a country that has got high rates of HIV. So the island of Hispaniola has got the highest rate of HIV outside of sub-Saharan Africa. So it's the highest in the Caribbean, highest in the world outside of sub-Saharan Africa. So when I discovered this, the question became, okay, we've created a program that can both treat infected individuals and treat pregnant women so they'll have AIDS-free babies. Can this also be done in a place that has fewer resources? And so we began working in 1999 in a little town called La Romana, which turns out to have one of the highest rates of HIV on that island, because there's a lot of migrant labor there and a certain amount of trading, sort of sex trade, that sort of thing. And so we introduced the first treatment for pregnant women with HIV and showed over the next few years that indeed we could accomplish many of the same things that we did in Harlem, which is to say you can virtually eliminate the possibility of pregnant women with HIV having a baby who is infected.
Now, is that program being replicated in other parts of the Dominican Republic, or do you have plans to do that?
Well, one important thing that's happened in the intervening, we've done a lot of work with the Ministry of Health in the Dominican Republic, and the level of treatment that we introduced in La Romana has now become the standard of care for the entire country. So our regimen is being used throughout the country. But it's also being the same approach that was started at Harlem Hospital is also being introduced, or has been over the last 5 or 6 years, introduced to over 800 programs throughout Africa, Thailand, Uzbekistan, as well as Russia that you mentioned, and of course our work in the Dominican Republic.
And this is primarily through the Columbia University's International AIDS Program.
Yep, there are two programs. The one that I started in 1999 is called the International Family AIDS Program. My colleagues at Harlem Hospital started another program that's called the International Center for AIDS Care and Treatment Program, and that has been replicated on a very large scale, doing wonderful work in many places.
Now, that's really remarkable that you mentioned a minute ago, how you can treat a pregnant mother, and basically eliminate this AIDS virus in the child, the unborn child, which is really wonderful. Are there statistics as to how well we're doing? We heard some horrific statistics 10, 15, 20 years ago about how it was just a pandemic that was raging around the world. Do we have better statistics today, or is that changing, or do we have?
Mercifully, it has changed, and for a number of years it just seemed that there was really not much progress being made. But indeed, if you look at the latest statistics from UN AIDS, there still looks like there's around 30+ million people who are infected, but the rate of spread has slowed. Significant numbers of people are now on treatment, and these regimens to treat pregnant women from being infected are being used in multiple places all over the world. And this is really a combined effort of the World Health Organization, UN AIDS, the Global Fund for AIDS, Tuberculosis, and Malaria, Bill and Melinda Gates Foundation, the Clinton Foundation. There's multiple players doing this, but it's a very thoughtful and widespread effort by many different partners.
Now, the UN, you mentioned the United Nations AIDS, and of course the United Nations in 2000 developed the UN Millennium Development Goals, 8 logical, quantifiable goals, and I think goal number 6, I'm guessing at this, was to reverse the AIDS pandemic, which 13 years ago it was a pandemic at that time. Yes. And we look at the situation today, there are hospitals around the world that are treating AIDS patients. Some of them are very well staffed. Some of them have state-of-the-art equipment. Others are just really shacks. They
That's
have
correct,
nothing to really, and it's so sad for everybody who has AIDS, but especially children. And the fact that they're born with this horrific virus, and we try to deal with that. But you mentioned the partners, and they are so critical. How can we get the UN AIDS, the Clinton Foundation, all these groups to get more involved in the future and help maybe to improve these hospitals, provide better equipment in the hospitals, perhaps get the serum out or whatever the case might be? Are there things that we can do in the future to get them more involved? I know the UN is very involved, as are these other groups.
Well, I think that all the major partners have worked well together. What we're facing at the moment, however, is the threat in this economic downturn of decreased funding of, for example, the Global Fund, of PEPFAR, which is the President's Emergency Plan for AIDS Relief that was started under George W. Bush, but has treated literally millions of individuals for HIV, both for infection and to prevent infection. So I think the most important thing right now that we all can do as collaborative partners is to really let people know how much progress has been made to ensure that we don't go backwards, because that's the danger. Mm-hmm. I think you're going to hear, and it surprises people to hear this, you're going to hear a lot of publicity about the possibility of an AIDS-free generation. And why is that possible? Because of the prevention of mother-to-baby HIV transmission. So that's the beginning, and then of course once those kids grow up and become sexually active, to keep them AIDS-free is the other part of that possibility. But an AIDS-free generation is a possibility now if we continue doing what we're doing.
And we're certainly moving in that direction.
Yes, we are, yes.
That's very important. Now, we were talking about some of the quasi-public organizations such as UN AIDS, the United Nations General Assembly, the Clinton Initiative's private. There are other groups out there, service clubs. How do you interact with groups such as Rotary International? Were they involved? Did I read that they were involved in your project in the Dominican Republic?
Rotary has been just a phenomenal partner for us. They've been involved with us in the Dominican Republic since 2006, and they helped us fund what was a little demonstration project just to see if working on a small scale we could begin to do this prevention of mother-to-baby HIV transmission, this prevention project with pregnant women. And it worked. So they then gave us a matching grant, and we took our little pilot project to the provincial hospital, La Romana, greatly expanding it. We're now testing about 9,000 pregnant women a year. We're finding about 95% of the infected women who give birth in the entire province. And none of that could have happened without the Rotary Club. So they've been a phenomenal partner, and I don't think they're going to leave us as a partner. I think a long-term relationship has been established.
Well, you're watching Global Connections Television, which is an independently produced program. The opinions expressed on Global Connections are solely those of the moderator and his guests. We'll be back in just a moment after this important message. Welcome back to our program. Today we're focusing the spotlight on a horrific disease, AIDS. And my guest is someone who's very involved in combating this terrible disease. My guest today is Dr. Stephen Nicholas. Dr. Nicholas is a pediatrician and a pioneer in the care of HIV-infected children and their families. He's been involved in a variety of anti-AIDS programs in Harlem Hospital in New York City, as well as in various areas around the world, such as Russia, Haiti, and the Dominican Republic. Dr. Nicholas, Steve, we've been talking about this AIDS situation and how there's some good news in this particular area. And one of the reasons is that you've been able to bring in partners. And you mentioned Rotary International, which is one of the largest service clubs in the world with over 34,000 service clubs around the world. But there are other groups out there too. Have we been able to bring in organizations such as Kiwanis International or Lions? I know they all have their different areas of emphasis, like with vision programs, like Lions works with the UN World Health Organization. Kiwanis has worked with UNICEF, the UN Children's Fund, on iodine deficiency disorders. But are there other groups out there that are involved or that you would like to get involved in the future?
I think all of these groups have got something really valuable to do. They've had different partnerships in various ways, and all the clubs that you just mentioned are doing important work, and we'd be very interested in partnering with them.
That's extremely important. Now, when you were involved in starting the Harlem Project, and that was really a pioneer project to a large degree, did you think that you would be able to take the concepts or perhaps the prototype of this project and take it to a developing country, an economically developing country, say a Haiti, or a country that maybe didn't have quite the physical or the medical or the professional infrastructure that maybe New York had or Harlem? Did you think it was transferable?
I was extremely skeptical, and for a couple of reasons. When we started our program in 1999, AIDS drugs cost $15,000 a year for one person. So it was for a 3-drug cocktail, $15,000 per person. So that when we went, we thought that probably the best we would be able to do was this much less expensive way of treating pregnant women, and that was true. But you see, the problem is if you only treat the pregnant women so they have AIDS-free babies, well, that's a big deal. That's a good thing. But if that's all you do, you see, you're really creating orphans because that mother's going to die. So it felt risky as we began this program, but we immediately wanted to treat that woman and her husband and the other children. You know, we wanted to do this as a family package. If it hadn't been for the fact that AIDS drugs came down tremendously in price, and there's a lot of people to give credit for this, but Bill Clinton himself, President Bill Clinton, helped to negotiate some of these prices with drug companies so they produced generic drugs. And so, thanks partly to him, thanks to other players as well, the Global Fund that I mentioned earlier, drug prices went from $15,000 to $10,000 to $5,000 to $1,000 to now it's a few $100s per person per year. And the Global Fund, which collects money from all sorts of different donor nations and private corporations, donates those medications to many countries. So, for example, in the Dominican Republic, AIDS drugs are free. And so suddenly we were able not only to treat the pregnant women, but we were able to treat everybody else in the family. So those little babies that were born AIDS-free grow up and their mothers watch them grow up. Their fathers watch them grow up. So that was sort of pinch me, am I dreaming sort of phenomenon. So no, we didn't see any of that really coming down around the bend, but it's happened, and it's happening now all over the world.
You mentioned how attitudes are changing, and I'm thinking, let me set a specific example for, you've not been there probably, but we hear more and more about women who are being raped in war zones. Like in the Democratic Republic of Congo, a woman was raped, she became HIV infected. She, of course, was able to look at UN agencies to provide assistance to her, UN AIDS, psychological counseling, and that type of thing. But how has that, let's talk about it more in a general sense, how has the stigma of AIDS, and there was a stigma you mentioned earlier, it was usually just gay men, but that is no longer the case today. It probably never was even back then, but how is that stigma changing? And this woman was ostracized by her community, and here she had HIV AIDS, and her child would probably have it unless they were able to do something special to help. But how is that changing, that stigma of AIDS, and how the family and the community are becoming more involved in some areas to help the victim?
During my 30-year career, I've seen horrible things done because of the stigma related to AIDS, because of the fear related to AIDS. Bad things have happened in the United States. Things are better. It's not to say that there's not still stigma. When I began working almost 15 years ago in the Dominican Republic, it was the same sort of stigma that I'd experienced in the early days of the epidemic. Doctors didn't want to take care of patients with HIV. People ran the other way. This is a very horrible secret. What has made AIDS less stigmatizing is the fact that there's now hope for treatment. So it's not perceived to the same degree as AIDS is going to automatically kill everybody. So we found through education and through, I think, publicizing the evil that stigmatizing does, the harm that stigma causes in people's lives, by that and by making sure that people know that there is now hope for, that my little AIDS babies who were all going to die, most of those kids are now in their 20s. The oldest is in her 30s. Okay? Those kids are going to live a normal life. So when you wake up to that, HIV begins to lose some of its power. You mentioned this rape case in the DRC, terrible thing, but I just want to make one comment about the fact that AIDS is overwhelmingly, even though in the United States it seemed like it was predominantly a disease of white, middle-class homosexual men, but in most of the world it has been a heterosexual epidemic, and it's really primarily about power, the powerlessness that women have got, the lack of control over their own lives. And so part of our efforts in making this world free from AIDS and AIDS stigma is to grant women more control over their lives so that they don't have to trade sex for goods or other things. There's a lot of microeconomic enterprises going to try to empower those women. So these are all good things that also will help to reduce some of these issues around HIV.
So your International AIDS program, you're working on the disease, helping the victims of the disease, but also helping to empower them to become financially secure, to have social security, that type of thing?
That's correct. Terribly important as an adjunct. Yes.
Yes. And I mentioned earlier the 8 United Nations Millennium Development Goals, and as I recall, number 5 is to empower women. And of course, that is absolutely critical because they are truly the victims. As you mentioned, it's a heterosexual problem in most other areas of the world.
Yes.
And it's usually the women who are at home and the men who are out contracting AIDS someplace else, and then they bring it back to the home. So it's a major problem. It certainly is. Now, one thing that it is very important that women be tested or receive HIV testing. Is that easy to do, or have you run into problems or obstacles in this particular area that obviously prevention is better than cure to a large degree, or once you find out the problem?
When you tell people, we've got this marvelous treatment that can prevent a woman with HIV from passing it to her baby, that sounds like the miracle cure right there. And it shouldn't that just be easy to go out and make sure that women get that treatment? But your question actually gets at one of the hardest things to do, which is make sure that every single pregnant woman gets an HIV test, gets the results, and then of course that somebody acts on those results. So it was true in New York, it was true in the Dominican Republic, it's true everywhere that I've worked. Just doing something so routine as getting a pregnant woman an HIV test is not easy. It takes a lot of organizational infrastructure. And even in New York, we've got a very good healthcare system, very expensive healthcare system, but goodness, what energy it took to get this done. And it took a good 10 years for us to do it. We're working in La Romana, it took about 7 years to get to the point where 95% of all pregnant women get a test. But this is the linchpin.
And it goes back to education and empowering women to a large degree, those two ingredients?
Well, it's partly that, but it's also making sure that you've got a health system that can do something simply routinely. And I don't have time to give you all the different reasons why it's not easy to do, but part are structural, part are attitudinal, part are healthcare related, part of the women themselves. And so you've really got to work on all those different horizons to make progress.
You mentioned a minute ago about a myth, like everybody gets AIDS. You're within a vicinity 5 feet of somebody who has AIDS. Everybody within that 5-foot area will contract AIDS, which is not true. What are some of the other myths that are being broken down, that are being dispelled about this disease?
Well, I think transmission is probably where I would begin immediately, because this fear of being anywhere near somebody with HIV as though the virus is going to jump on you. So there are many ways you don't catch HIV. It doesn't fly through the air. It is not transmitted by insects. It is not in sweat or tear. You don't catch it from sweat or tears. You don't get it from urine or feces. You get it from blood, and you get it from sex, and from breast milk. Those are really the only 3 ways that you're going to get it. So I think once people understand that, you can shake hands, you can hug somebody with HIV, you're not going to get it. So that helps relax people. And in the Dominican Republic, when we started working there, doctors and nurses didn't know the basic infection control information. Now once they understood, I'm not going to get this just by routinely taking care of a patient, they relaxed. Made a big difference.
Now you're doing some extremely important work, and you've encountered just a myriad of wonderful people along the way. In the last 30 or 40 seconds, is there some person or some event that will stay with you the rest of your life? That I'm sure there are many out there, but to find that something has just really been so profound that it just shook you to the core?
I think it's really these children that have survived. People ask me, why do you still do AIDS work? And it's really because of the patients themselves. And I don't think people realize how absolutely sad it is for these children growing up, because oftentimes mom has died, dad has died. And a little boy came to me and said, can I see one of my baby pictures? Because nobody in my family knows what I looked like as a baby. I had his only picture from when he was early in his life.
Well, Dr. Stephen Nicholas, I want to thank you so very much for a very interesting and a very informative program.
Thank you, Bill. Great to be here.
Thank you. I'm Bill Miller. Thank you for joining us on today's Global Connections program.